Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, 45-year-old a female complains of lower abdominal pain with vaginal discharge. On examination, there is cervicitis along with mucopurulent cervical discharge. Then the gram stain of the discharge shows presence of abundant pus cells and no bacteria. The best approach is, if there is abundant pus cells with no bacteria, then that is definitely the chlamydia. Abundant pus cells with no bacteria, it is chlamydia infection, where the chlamydia is gone or cultured on McCoy cells. Okay, next. Drug of choice for chlamydia in pregnancy is penicillin is the drug of choice.
Sorry, it is not penicillin. Drug of choice for chlamydia in pregnancy is actually erythromycin. Erythromycin is the drug of choice for chlamydia in pregnancy.
thank you and thank you for watching.